We see the future of data as being really exciting, and one of the ways that we think it's very exciting is it starts providing some quite strong evidence for being able to make changes and develop strategies to improve the way we deliver health services. If we have the data, then we can do modelling and we can actually look to do some scenario planning and understand what perhaps the consequences of some decisions will be and whether they may play out the way that it's hoped that. We're going through a fascinating revolution across the planet at the moment as the world goes online. And to some people it's about the internet being there and being able to do business over the internet, communicate with people via video conferencing. But it's actually about a whole lot more than the communications. The world is changing, everything is changing as we go online. And it's all about data that now exists that never existed before. We can understand patterns about how people do things. We can start understanding patterns about the way people make decisions. We have the whole emerging world of big data analytics because we can see how a population responds to something that we simply could never before because we didn't have the global view and we didn't have the information to get the understanding. So CSIRO has set up the Digital Productivity and Services flagship as its response to help Australia with the challenge of the digital economy and the way the world is changing and the opportunities for Australia as everything goes online. So my research team focuses on 3 areas. One of them is around broadband health, and that's about the way that clinicians connect with patients and clinicians connect with other clinicians using technology and things like national broadband infrastructure. So it's about what are the best ways of doing telehealth? How do we improve access to services? For example, we have a project looking at delivering eye care services into the Pilbara, so a very remote part of Western Australia where there are no ophthalmologists. How do we use telemedicine and telehealth services to be able to enable people there to access expertise in Perth? We're also looking very much about chronic disease management. There's been a lot at the conference here about the fact that people with chronic disease are disproportionate users of the health system and that there are great gains to be made both to their quality of life and to the health system as a whole if we can find ways for them to better manage their own health and their condition. They don't want to be sick and the system doesn't want them to be sick. That's one area. The second area, which is what the talk tomorrow is going to be about, is about how do we make the future of Australia's health system sustainable? How do we do the most we can with the resources and the system that we've got? So a lot of this is about operational modelling and operational productivity tools that produce productivity gains in a responsible manner. So they're not endangering patient health. They're looking to improve patient outcomes, improving quality of care, but at the same time getting operational improvements in how we use the services and how we get the most out of the resources that we've got. The third one, which I'll just mention briefly, is also about the personally controlled electronic health record. How do we help Australia to move into electronic records, both health records and medical records, and then how do we help get the best value out of those clinical records that we're creating?
So just moving on to the next question, and it's about which areas you feel that you could have the biggest impacts on safety, quality and efficiency.
So there are many, many different ways of answering that question. One of the interesting things that we're finding in our work around health is that start that one again. We know that there are some disproportionate users of Australia's health system, so particularly people with chronic disease. There was a number here earlier today saying that 1% of patients are responsible for 30% of public health costs. I've heard somebody from the private health sector say it's 1%. 40% of their claims data. The numbers are that there is a very small group of people that we could offer additional services to and proactively help them to manage their health, stay out of the system, which means a better outcome and a better quality of life for them and potentially a huge impact on the service itself. If those people aren't in the system because they're looking after themselves at home, that reduces the pressure on emergency departments, it reduces the overcrowding in the hospitals, it reduces some of the adverse events that we know happen when hospitals are overcrowded, and it'll just reduce pressure on the system overall. So we think it's absolutely critical. All our work is clinically partnered. We don't believe that this kind of research can be done in isolation away from the system that we're trying to help understand how to improve.
Mm-hmm.
So where appropriate, we work with the hospital operational management side of things. Where we're looking at clinical systems, we look at partnering with clinicians. If there's an overlap in those stakeholders, then we talk to both groups.
Mm-hmm.
But one of the things that we had learned very early on is that doing the science gives you an evidence base, it doesn't give you the change. There's been a lot of discussion here about change management, and you can't do the change management without working along the system that you're looking to influence and really understanding what it needs.